Do you use AI chatbots for health questions? You may want to rethink it. A study published in Nature Medicine found that OpenAI's health-focused chatbot failed to identify more than half of simulated medical emergencies requiring urgent care. Researchers tested the bot's ability to assess the severity of medical issues based on real-life situations. The company just launched its health-specific chatbot this year. This is a free platform which currently has a wait list to join. Meanwhile, millions of Americans are already using other AI chatbots for medical advice. Let's bring in MS Now medical contributor and pulmonologist Dr. Vin Gupta. Doctor, this program, ChatGPT Health, is supposed to be a more secure and health-specific AI assistant. But based on this study, clearly it has limitations. What are they?
Yeah, Anna, pretty significant limitations. And I should first say I'm a big believer in health technology, hopefully improving healthcare access for Americans across the country at low cost. But it's not quite there yet. And what this found was exactly as you said in the tee-up, there was a misdiagnosis or when it comes to the nature of an emergency, almost half the time, didn't really pick that up. It over-triaged non-emergencies. So it said, go to, say, an urgent care when perhaps you had a condition that could require at-home care. And so that nuance is important, especially when we're dealing with psychiatric emergencies. That's where ChatGPT Health and specifically has the greatest weaknesses, it appears, suicidal ideation, really understanding who needs help if they have a mental health emergency. That's where it struggles.
Even on OpenAI's website, it says this platform's not intended for diagnosis or treatment, but people still want to use it that way. Just to underscore, what are the dangers of relying on an AI tool for diagnosis?
I say that as a pulmonologist, usually people come to me and I have the opportunity to physically examine them, listen to their heart, listen to their lungs. And Anna, I think that's the key piece here is if you're typing into an AI chatbot, again, 40 million users across the country are using this type of tool. So it's here to stay. It's going to get better over time, but it can't do a physical exam. And it's missing some of that nuance that you can elicit in that in-person examination to see if somebody's struggling to breathe, for example, or if they need to see somebody, like go to an ER. That's what's missing there. So it's really important for all of you to keep in mind that's listening. If you have a loved one that's using this, don't just rely on this alone. It's not a substitute for seeing your actual medical provider.
I think a lot of us have gone to Google or some other website or technological tool and just typed in a symptom to try to figure out what's going on, this sort of self-diagnosis. How different is using this AI versus a website like WebMD, for example?
I especially with the proliferation of medical falsehoods out there, Anna, I'm a big believer that this is going to be a good thing for the world when properly utilized. And so, it's different because you can type in a set of symptoms or I'm experiencing whatever it may be and get a tailored response back. So if you put in a lot of information on your symptom profile, Anna, you'll get a pretty specific response back. So that's why it's really attractive and it's making waves because it feels like it's precise. But again, it doesn't substitute in-person evaluation, especially if you're having something like chest pain, if you have an underlying medical condition, shortness of breath. That's where I'd want you to go and see your medical provider. It's really important to have that layered approach.
And that being said, how should you use this type of tool? Are there benefits?
Tons. I think the best way is actually to prepare for your, seeing your medical provider, asking questions. You can input your blood levels, for example. If you get your blood test, you can ask better questions. You can be more prepared for that 15-minute exam. I know it's so tight. It helps you ask questions. It allows you to interpret your health data. And I think it's a first triage point for a lot of people that don't have ready access to healthcare to say, I'm experiencing something here. Should I go and see somebody in an urgent care or an emergency room? So it's a good way to triage your symptoms to determine whether or not you should go and actually visit somebody in person.
This is so helpful. News you can use. Dr. Vin Gupta, thank you for joining us. It's so nice to see you. That does it.